Good afternoon. I'd like to call this November meeting of the Jail Oversight Board to order. If we can all rise for the Pledge of Allegiance. I pledge allegiance to the flag of the United
States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
A few administrative matters. We have joining us virtually today, Sheriff Sanders, Judge Whalen, Judge Brennan, and Ms. Deborah Love, as well as Mr. Jonathan King, who I just see joined us as well. So I think that's everyone, right? Missing, yeah, got the full team. Also, we had an executive session on Monday to discuss matters of public safety and matters of personnel. And with that, we'll go to the next item on the agenda, which is the first round of public comments. If there is anyone in the public who would like to address the board, now is your time, or at least your first opportunity. Seeing or hearing none. The next item is an approval of the October minutes. Do I have a motion for approval?
Motion. Second.
The motion is second. Any questions or comments? Hearing none, all in favor?
Aye.
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 Any opposed? The ayes have it. All right. Next item is an approval of the October reports. Do we have a motion?
Motion.
We have a motion and a second. Any questions or comments on the October report? Hearing none, all in favor?
Aye.
Aye.
Aye. Any opposed? The ayes also have it. All right. Warden?
John is assisting in getting the presentation up and going. Good afternoon, members of the board, and welcome to our November meeting covering mostly items from October of 2022 and then proposals moving forward. As discussed during last meeting, I have retitled this initial slide. Instead of providing a COVID update, I am providing an infectious disease update, which does provide updates for COVID as well as monkeypox. We have tested, and I do have a typo on this slide. It says in the month of August. So in the month of October, our facility tested 113 incarcerated persons utilizing PCR tests. 4 out of the 113 were diagnosed as positive with COVID-19, and we have 2 positive cases currently, both reported to be asymptomatic. We currently have 553 incarcerated persons who are vaccinated, which is accounting for 45% of our population is vaccinated from COVID-19. It is also flu season, so we are working with WellPath to make sure the influenza vaccines are not only offered, but consistently available, especially to those that are in a higher risk population category. We do not currently have any staff out with COVID-19, and there are 0 confirmed or suspected cases of monkeypox within our institution. Our current population as of today, and I bolded this because it's not an October statistic, but from today, November 9th of 2022, 1,229 incarcerated persons. And that actually, I think, is inverted. It should be 1,929 individuals who are in our custody at present. I will get clarification on that. That is, however, a decrease of 92 from last month's meeting where we were over 1,300 incarcerated persons.
Sorry, you said what's the number?
1929.
No, I can't be right.
I'm sorry. No, 1292. There we go. Numbers are very hard for me today. So 1292, I appreciate that clarification for the record as well. We did resume our weekender program. So the administrative order was lifted as of October 22nd, which was a Saturday. And typically our weekender list runs from Friday until Thursday. So beginning that first weekend, we had 12 individuals. The second weekend, which was the 28th through the 3rd, we had 45 individuals report. 11-4 until yesterday, it was 64 individuals, and we have 35 scheduled to return for weekender sentencing this Friday on the 11th. I have to say that this was an enormous undertaking. We are not utilizing the facility that we typically used for weekenders, and we did a full modification of processes and procedures within the institution, which required a lot of collaboration between the security department, our classifications department, healthcare department, and intake to make sure that everybody was processed appropriately. Additionally, making sure there was accountability for the money orders for those that were completing their sentencing. Our first weekend had a little bit of hiccups, but we learned a great deal. The team took leadership in reevaluating the opportunities to strengthen that while we are, continuing to resume these services. And we've been getting consistently more efficient as the weekends go on. I have to give credit fully to my team. They worked this out and made sure that they were consistently reevaluating what needed to be done to observe the obligations of the persons in the most efficient manner as possible, because this is very different than how the facility has typically done this. In October, we had 510 commitments, which is a reduction from the previous month, and we had 521 discharges. You can see on the screen that we did afford full recreation to the housing units. That has been very consistent since we made that change in August and increased the tablet availability. We did have some anomalies. I won't name them all because they're listed in the presentation for your review. And we did have a major incident at the end of October, which I did make notification to the board. There was a pod disturbance on 10/28. There were no injuries to staff or incarcerated persons. Again, exceptionally proud of my on-site leadership team. 2 of my shift commanders maintained point for that incident, and they were able to resolve without any injuries to anyone or utilization of force. So wanted to report on that. We also maintained, again, the same number of shakedowns or thereabout, pat searches and cell searches from September to October, and identified serious contraband 16 times in the month of October. That is an increase of 13. So we do find nuisance contraband pretty frequently, but serious contraband would be something that could be perceived as a danger to self or others. You can see on this slide 2 of our most recent graduating classes, and I wanted to have a specific shout out to Judge Whalen, who is a member of the Jail Oversight Board and has also been engaged in our graduation ceremonies as of late. He has been performing the oath and swearing in of our officers, and his speech and presentation throughout that graduation is incredible. He has an enthusiasm and passion for this. And I think that he's really been able to help the officers understand the duties that they are undertaking in these ceremonies.
Well, I thank you. I wouldn't use the word incredible, but I thank you, and it's my honor to try to help.
We would. So you don't have to, but we will certainly use that word or adjective. So we did have classes that were sworn in by Judge Whalen on the 21st of October, as well as the 4th of November. And we have 2 academies that are starting this month, one next Monday on the 14th and another on the 28th of November. We have added an additional class to finalize our academy training schedule for this year. That will take place on 12/12. And those last 2 classes will graduate at the beginning or mid of January. Our 11-14 class will graduate right before the Christmas holiday. So we are looking forward to those staff coming on board as well. We are constantly seeking opportunities. Again, I don't have to spend a lot of time on this slide. If persons are listening in the public, you can Google George W. Hill Correctional Facility. There's a careers web link, and you can see any of the recent job postings that are available. We've even included links to our contracted healthcare provider, which is WellPath. So anybody who is listening or knows somebody who is seeking active and gainful employment with this county or in the institution, we would certainly welcome their application. In the month of November, we are celebrating the efforts of 3 of our staff for Employee of the Month, and you can see them listed there. We have Sarah Bowles, who is our Compliance Manager, Dan Ryder and Steve Young, who are both Operations Technicians, and they were nominated and selected amongst their peers this month because of their efforts to really assist our facility and ensuring that we would have a successful Title 37 audit and inspection. All 3 demonstrated their willingness to go well outside of their job classifications and duties to support their peers, as well as their leadership staff, to include me, leading up to and during the inspection, as well as thereafter. This month, we also recognize Veterans Day. And in the month of November, I am a little stereotypical in which I typically practice gratitude. So I was reflecting how lucky I am in general to be assigned the duties and functions of the warden of this facility and to work with and represent my staff, but was feeling especially grateful for those who have served our country. And I am lucky to come from a family who have had multiple people serve and have had friends serve as well. Few people may know, but the executive director of our county has also provided service to our nation as a member of the U.S. Army Corps of Engineers, as well as the Texas State Guard. So I wanted to make sure that we had a moment that we could recognize his service, not just to Delaware County, but to our nation, and also recognize my 2 current employees, Officer A. Crawford and Wellness Instructor Greg Beedling, who are also still actively employed as well as serving in the armed forces. We have many staff throughout the ranks of the institution who are veterans of the military, and we have 25 incarcerated persons who have served in our military. So wanted to make sure that we dedicated some time during this Jail Oversight Board to give thanks and gratitude and recognize those who have done what they can in service and sacrifice to our nation. In terms of civic duties, we wanted to talk about the election day yesterday as well. So it may not be on most people's mind, but voting does happen in correctional facilities. There are persons within our custody that have the right and the eligibility not just to vote, but to make sure that they are registered to vote. And early in the transition of our organization, we had outreach and partnership from the League of Women Voters, the Delaware County chapter specifically, who were very interested in assisting in our voting processes. They agreed to pause with their enthusiasm as we were getting our feet underneath us, but promised that they would revisit their intentions to support our initiatives and efforts later. Thanks to them and the organization of my programs department, we did host training on site that was for our case management staff.
Why?
Program staff, our mailroom was involved, reentry, workforce development, as well as some leadership within the institution. It was very eye-opening and reasserted the importance of making sure that people are educated on the rights of voters. We completed on-site surveys, and I'm using the royal we, but I should really give credit to the programs department, specifically Administrator Shaw and Workforce Development and Education Administrator Skursky, because they helped with the senior case managers and case management staff in really taking the lead in these initiatives. You'll see some data reflected on this slide, and I should add the caveat that this data was only captured between 10/11 and 10/21. Unfortunately, we failed to continue to collect data, which is an area of opportunity for us in future elections. But our efforts continued all the way up until the deadline. As of 11 a.m. yesterday, we still had postmasters coming to do sweeps to make sure that we had no remaining ballots on site. Voter registration and request for mail-in ballots is located in the law library year-round. Our staff utilized the tablet facility messaging system to send reminders of deadlines for registration and voting. And we also included the who is eligible criteria for education on voter registration rights and voting rights. The process was explained by Administrators Shaw and Skursky during an impromptu block rep meeting. Case managers also took it upon themselves to do informational sessions on each housing block and unit to educate on eligibility and answer questions. The Delaware County Bureau of Elections provided postage for out-of-county forms and surplus forms, and our mailroom assisted in sorting and delivering. This was a pretty exceptional experience, and I want to make sure that it is known this is not the first time that voting has happened at George W. Hill. The staff have been dedicated to observing the rights of those that are incarcerated for a very long time. This year was different because we engaged some outside partners in a different way, as well as increasing the expectations of our case management staff, who was very integrated into the success of this process. On October 27th, our facility hosted 2 inspectors from the Pennsylvania Department of Corrections for our annual inspection. And this is frequently referred to as Title 37, which actually refers to a state code, specifically Chapter 95, which articulates a set of standards and regulations. These are minimum standards and regulations. We're all encouraged to exceed those for county correctional agencies to apply to their policies, procedures, and operations. And they come to do an inspection as well as fidelity testing to make sure that we are saying what we're doing what we're saying we're doing in our policies, and that they're able to do an environmental review and have discussions with our staff as well as incarcerated persons. Preliminary findings will be addressed in a corrective action plan, and then a final report will be provided to our facility as well as the Jail Oversight Board. I was doing so well with this. Something that is new, in discussion with Aramark, we are going to be expanding upon some opportunities that are available for the incarcerated population. Aramark has a gift packaging that is separate than their typical commissary menu, and they refer to it as an eye care package. Most of the commissary providers have some kind of package that is put together that allows family members or loved ones to purchase for the inmate or on behalf of the incarcerated person to be given to them, which is a little bit extra different or a bit of a surprise. We will have by November 20th the availability of the eye care packages that family and friends will be able to order in 4 different bag sizes, ranging in prices from $30 to $80. We're still working with the vendor to establish the schedule in which the additional packages will be offered. Some facilities choose to do this quarterly or seasonally. Some do it for major holidays. We're working with them to see what we will be offering, but we are excited that we will have this opportunity for friends and support of our incarcerated persons. Cost recovery. We are still, as voted on, collecting a processing fee, though it is reduced. It is now $50 instead of the $100. So you do see a decrease from last month to this month. And in the first column, that is the last month that we recovered. The annual year to date is on the right-hand column. So we are still capturing a restitution for prison property that has been damaged, medical visits that are deemed not an appropriate or clinical use of services, and postage. And then at the bottom, we did separate it out this month. The money that is deposited to the inmate welfare for any person who leaves with less than $1 on their account. We can see that that has only totaled 29 year to date since we started, but it has definitely saved a large amount of resources for my staff in printing the checks and verifying those accounts. So before I move on to asks, I should pause and maybe take a breath and see if there are any questions or comments to anything that I have already offered thus far.
Any questions or comments from board members? I will just add my thanks to our veterans, both on the board and who either work or reside at the jail, and also to our Judge Whalen for admirably representing the Jail Oversight Board and the bench and recognizing our new cadets. Other than that, I don't have any other questions, so we can move on.
Great, thank you. So we have a series of asks coming up, and some of these items I think were historically done, but maybe not discussed with the degree of public transparency. So we wanted to make sure that we took the opportunity to address those items. Holiday gift packages have been historically provided to the incarcerated population. The way that we would like to do it this year is a little bit different. So we would like to have an opportunity for community as well as collaboration with some of the people who have been recognized as advocates and supporters of the institution. We would like to allow for staff to engage in this because it can be an uplifting experience. So we are seeking to purchase wholesale product from one of our vendors in order to make gift packages for the entire population within the institution. And I've included the inventory of items that we would be seeking to provide, as well as the amount of each item that one person would receive. And then you can see our total number. We based this off of a population that is 1,400. So that is larger than what our current population is. But we wanted to make sure that we had enough in the event that we do see more individuals come into custody. We would spend approximately $7.94 per package, and we would be requesting to utilize the Inmate Welfare Fund, which previously funded and supported these efforts in order to do this. We will be selecting, we've not finalized that yet, a day in which we will be gathering to put the packages together, and then there will be a second day in which these packages will be distributed to the population. And we will also be allowing for a small group of volunteers to participate in that. But any questions, comments, or consideration, but I would put that to the board for your consideration to be able to order this product and pay for it from the Inmate Welfare Fund.
Is there a motion to support this allocation of inmate welfare fund expenditures?
I'd make that motion.
I'll second.
Motion is second. So any discussion of the matter by board members? Hearing none, all in favor?
Aye.
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 Any opposition? The ayes have it. Thank you, Warden.
Thank you. We also have, and this is something that currently impacts the Inmate Welfare Fund as well. Our facility provides two different manners in which somebody can access legal or law library services. And it may not be widely known, but the District Attorney's Office, the Public Defender's Office tends to utilize Westlaw. Whereas in the facility, we're seeing a larger reliance on LexisNexis right now, only because we've added that to the tablets and every person has access to a tablet. The way that Thomson routers or Westlaw is currently provided to our population is in the physical legal books, which are extremely expensive, and those are located within our law library. We did have a discussion with the current contract provider and vendor, and they are able to actually expand the availability of services with an enormous, I say enormous, but a significant or substantial reduction in cost. So the current projected 2022 total cost that is already being deducted from the Inmate Welfare Fund is $193,906. If we went to an electronic version of this, every incarcerated person would have access to it anytime they had access to a tablet, which is a significant portion of their actual day. And we would have the capacity to still make this available in the law library portion of our building. We have kiosks or computers that they can access there. So we would be able to reduce the overall burden of cost while expanding the services by executing this 5-year contract. So in 2023, the annual cost would be $100,000.80, which is a reduction of $93,905.20. So I felt compelled to present this because it is a significant savings while expanding services. It does require us to engage in a 5-year contract where you do see that there is a 5% increase in the following years. So I've actually calculated those out. 5-year contract would be not to exceed $552,567.48. If we stuck with the current system, the projection of only 2022 through 2025, which is missing 2 years, would be $968,245. And that's still missing 2 additional years. So we would be well over $1 million in cost to the inmate welfare fund for the life and term of this contract.
Gordon, could you just clarify for me, when you said, I maybe I misunderstood or misheard, but I thought you said the physical books would still be there as well?
No, the
They would not
physical
be.
books would not be there.
So
So
this would be
everything would
more-
be electronic.
Okay, but your point is that it would be more accessible to the population because they will all have access to tablets and it'll be on every tablet.
Yes. On every tablet and every computer within law library. So they have to go to law library right now to access the physical books. They could do this instead on the computer should they need additional assistance from a law librarian and notary.
And this would be in addition to LexisNexis that's already on there.
In addition to,
Okay, is there a motion to approve this expenditure?
I'll make the motion.
I'll second.
There's been a motion and a second. Any further questions or comments from board members? Hearing none, all in favor?
Aye.
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 The ayes have it.
thank you again.
Thank you, Warden.
For this portion, I can call one of my deputies up, but I didn't tell them that I was going to do that. And none of them are readily volunteering. So Deputy Portillo will come up and join us. You can see in front of you a carpet square, and this is the physical footprint, at least of the space that would be taken. It certainly doesn't account for the height. But this is a body scanning system, which does an actual X-ray image to show internal anomalies, and an incarcerated person, when committed to the institution, would step in just in the manner that Deputy Portillo did, would be subject to an X-ray scan of approximately 3.8 seconds, and then would be able to exit with us having a clear visual of what might be in or on their person. So they could have some item that is concealed that was not detected during a PAT search. Body scanners are utilized in a large volume of state, federal, and county corrections facilities. They are the first line of defense for our correctional professionals and all incarcerated persons in our institution. It allows for contraband detection without people unnecessarily being subject to invasive searches. This would certainly give us an idea whether or not that person had something that needed to be monitored or obtained from them. This unit is also able to control and track the radiation dosage to ensure that a person does not exceed the 250 microsieverts per year. So you can change, and make sure that that tracking mechanism is there. It will give you alerts if somebody is getting close to it to make sure that they aren't exposed by radiation. I shouldn't have been surprised, but I was surprised to learn the amount that we're exposed to just in our regular day-to-day lives. It's not something we really think about, but when we talk about X-ray machines, everybody does get admittedly concerned because that is more in line with the purpose. Director Lazarus, you looked like you might have been going to say something. No? Okay.
No, I'm good, thank you.
Okay. For those of you who have been to our facility, our intake department is not very large. So when we're seeking different materials that are going to assist in increasing the safety and security standards, we have to be very mindful of the amount of space that we're going to dedicate while making sure that we still have ADA rights, that are observed. So we can't take too much of hallway spaces. You have to have clearance. You think about a number of emergency needs. If you need to get a person out as quickly as possible, you don't want something to be obstructing. And then in the case of this particular system, because it is a predominantly closed unit, the exposure range for the radiation is the exact same footprint as the carpet that is available, whereas many different body scanners require that you actually build a physical barrier to make sure that there isn't that additional exposure risk. 14 Pennsylvania County Correctional Institutions have this model. There are even more that have some other models, like Nuke Tech is one that is used in Pennsylvania as well. And the Pennsylvania Department of Corrections has committed that they are going to be utilizing this system too. A lot of people appreciate the considerations that went into this technology, though it is similar, it is also extremely different than the other systems that are out there. The total cost for this would be a request of $142,500. I did add the note there that some facilities have utilized their inmate welfare funds to pay for systems such as this one. I only offer that for the consideration, but defer to the judgment of the Jail Oversight Board and whether or not that would be an appropriate utilization of those funds. If not, we would be seeking to utilize operating capital budget costs.
Warden, can you speak a little bit to how you got comfortable that this is the right system for this facility and what we did in terms of scanning the options, no pun intended on the scanning word, but whether options were out there?
So thankfully, I come from a facility that did add a resource such as this one. We utilized a different model, which certainly contributed to some of my decision-making factors. I've learned through some of the challenges of other systems that include maybe a conveyor belt model. I've also been able to engage in discussion with many of the facilities that have this. Would they choose it again? And others who have chosen other systems, and knowing what we know now, what would they have done differently? And this is the premier choice in the county system of Pennsylvania, at least. In terms of my decision-making, one of the leading items was the overall size of the unit, as well as the efficiency and the clarity of the images. You get very clear images at lower dosages, which allows for utilization on a higher level of frequency if that would be required. I also appreciate that it is a stationary model. When you have a conveyor system for ADA reasons, you may have somebody who cannot step onto the platform that may be unsteady or a fall risk while on the conveyor system. So I look at mitigation of safety risks from a number of different lenses. So that certainly contributed to my discussion or my determination as well.
Thank you. Is there a motion to, Sen, I want to clarify, I think for this and the prior, given the fact that it's an over $25,000 expenditure, this would be technically a recommendation to county council to support. That's correct. Do I have that right?
That is correct.
The previous discussion is a sole source and recognized. I brought that up to the county solicitor yesterday. So it's an exception to competitive bidding under the county code.
They did provide a sole source letter as well.
And with regard to this one, are we going to have a similar sourcing issue?
Warden, do we know if all the entities, all the prisons have a state contract?
I'm sorry.
Are you aware if there's a state cooperative purchase agreement or contract that everybody else has used to purchase this?
I'm not aware of that.
I think Gordon and I have talked about other ways that we can use other competitive means to make sure that it meets the administrative code. But I'll confirm that again with the county solicitor.
Okay, I just want to make sure we don't have a repeat of a few months back when we had to, slow things down and go through the process again. Are there questions, comments from the board? I guess we didn't get a motion. Is there a motion to approve a recommendation on the purchase of these body scanners?
One comment. I believe that it's appropriate and needed.
Sorry to interrupt you. We had a motion on the table. Is there a second?
Second.
We have a motion second. Go ahead, Sheriff. Apologies. Sheriff Sanders? Did we lose the sheriff? Are there other questions or comments?
This is
This is
Deb. While we're waiting for
recommendation.
the sheriff to come back, are we going to consider
using inmate welfare funds? And if so, does it still need
that
to
was my
go through
question.
the process?
I think that's up for discussion. And I think once we decide as a board, we can then clarify the motion that's on the table. Would you like to lead off that conversation, Ms. Love?
Sure. I know our warden has done her homework to identify the fact that other facilities have utilized the inmate welfare funds. And I guess I think that should remain on the table for us to discuss. I'm not sure I'm savvy enough to identify pros or cons, but maybe other members of the board are, and the warden.
Well, sir? Yeah.
Right. So I did look into this issue in anticipation of the fact that this was on the agenda. And there is some state guidance with respect to the use of inmate welfare fund at the state level. There's not county guidance, but the state guidance provides that inmate welfare fund proceeds are to be used for recreational and other services for the benefit of inmates. There are examples from Lancaster County, which does have a separate posted policy. And the examples include activities such as recreation, AV entertainment, holiday decorations, library materials and equipment, inmate programs, services for indigent inmates. So it seems that this is not typically the type of equipment or purchase that is contemplated to be made from an inmate welfare fund. I also would just note that there has been some commentary in news publications about the problems presented by the lack of clarity for the use of these kinds of funds and how that maybe presents vulnerabilities for counties. So I think we should just be very judicious in how we use these funds. My recommendation, I should say, is that the board be judicious in recommendations as to how the funds be used.
Yeah, and for situational awareness of the board, I think we have roughly $4 million in the inmate welfare fund.
Yes.
And I will say that, $4 million sitting in a bank account isn't really helping the welfare of the inmates. But I also think that, we will have other examples of ways to spend that money that is more, it sounds, reflective of what was intended by it. So I personally would prefer that we not use inmate welfare dollars here, but again, I welcome other views.
And this is Deb again. Thank you for that, Shelley. But you mentioned something in your commentary. So is the inmate welfare fund a source for funding for the library proposal that was done prior to this body scanner discussion?
Yes, I'm sorry.
Okay.
Wasn't sure to whom the question was posed, but yes, I think my reading of the parameters that have been established in other places is that yes, it is a legitimate source of funding for the library. And in fact, the proposal I thought that the warden submitted in the PowerPoint did recommend that inmate welfare funds be used for that proposal.
Correct. But I just wasn't sure that we actually made that a point of that approval. And I know I'm jumping back and forth, but you captured my attention with the mention of the library, knowing we just acted upon a proposal.
Yeah, Ms. Love, I'm personally comfortable that given how much of the conversation and the slide made it clear that it was savings from the inmate welfare fund, I think unless someone feels that that wasn't clear to them, I think the approval was fairly clearly coming out of the inmate welfare fund.
Great, thank you. I did miss that, so my apologies.
Not a problem. Other thoughts from board members?
I'm supportive of this, and it's going to go to council. I think that the appropriate budget line, but if it's capital, which it would seem to be a capital expense, would be put into council. So I support this, and I would leave it to council to determine where the funding properly comes from.
Yeah, I think so long as this body makes it clear whether or not they want to use inmate welfare fund dollars versus general county dollars, I think, as you said, Controller, I
Right.
think, when it gets to county council approval, they can be more clear about which of those two buckets it's going to come out of. All right, so what I'm hearing is not inmate welfare fund, but if someone feels differently, I'd like to hear from them. Hearing nothing further. We do have a motion and a second on the table. Is there any further questions or comments on the motion that's before us, which is to recommend the purchase of these body scanners, not from the inmate welfare fund?
I just have a quick question. Is this money already budgeted or is this to add on?
Great question. This is projected for our 2023 budget. This would not be an additional request that from what has already been submitted for council review. This would be incorporated within that budget.
You say a budget that it's already done. In other words, this money was already budgeted for next year.
We had a capital expense that we are going to be trading out if we are going to be taking this on in our budget.
So I think one way of saying there is room within the draft 2023 capital expenditure budget for this item,
Yes,
but it is a draft. It has not been adopted yet.
correct.
All right, thank you.
Any other questions or comments before we go to a vote? Hearing none, all in favor?
Aye.
Aye.
Any opposed? The ayes have it.
Thank you
Forward.
again. For our next proposal, we are asking for support in obtaining an accountability and monitoring software. I want to make the appropriate distinction that this is not a jail management system. So many of us refer to JMS in the correctional field, which is usually utilized for our housing within the institution classification procedures, as well as a number of other documentation that needs to happen when somebody is committed to an incarceration setting. This is something that would interface with our JMS system and would give us in real time accountability of what we would refer to as rosters for each of our housing units, which would allow for in-time immediate documentation of everything that would happen within an officer's day-to-day duties. Maintaining care, custody, and control in a large facility is a monumental task, and what our officers are asked to do day after day, usually at my bidding, is an enormous amount. And being able to accurately and clearly and concisely document that within a physical logbook can be cumbersome. And there are many times when it is not the officer choosing not to do something, but he's actually engaging or she is engaging with the incarcerated person, which is what we want, and maybe omitting some entries from a logbook, which is definitely not what we want. This system would allow, and you can see an image on the left-hand side of the screen, for the utilization of a tool that acts as a scanner as well, so that the incarcerated person's ID, either band or badge, could be easily scanned. And when a check or a monitor or a toilet paper roll or a feminine hygiene product or a shower or a recreation opportunity was offered, that can be easily accounted for in real time. This allows us to be able to better manage as well as report on compliance standards for the entirety of the institution. This also gives our officers credit, and I think it would be a bit overwhelming for many people to see the amount of work that they're doing in any given day. It can be very labor intensive, as we just went through our audit experience with the Pennsylvania Department of Corrections to produce all of the necessary documents. This would also allow for us to be consistently evaluating our utilization of resources, how we are appropriating or directing our staff, as well as whether or not we're meeting the compliance standards that we seek to achieve and strive for in the institution. This technology can truly revolutionize the way that we conduct our duties. and will assist again in documenting tours, safety status, supply distribution, monitoring, administration of meals, medications, and very much more. This is a one-of-a-kind system. It is also a sole source opportunity. We did engage our county IT staff, as well as facility IT staff in the presentations that we had from the vendor. I know of no other system that exists as comprehensively as this one does, and this would certainly allow us to raise up to the next level. The total cost of this for implementation, training, software acquisition, as well as the hardware is $150,100.
And can you clarify, is that a one-time cost? Is there a license that would cover a certain number of years?
So just so the public can hear those that might be listening in, this is the one-time cost that would be budgeted in the 2023 calendar year. There is licensing costs. We would be electing to lease the software and the hardware that was available to us, which would allow for upgrades as well as replacements if things are broken within the institution. And we would be subject to a licensing fee the second and third year of the 3-year contract term.
And what is that licensing fee?
Deputy Mastrotti is going to look that up right now.
Yeah, I think it's important that we understand the sunken cost as well as the ongoing costs. While we're looking for that, are there other questions or comments?
Warden, what is the benefits, or would this system benefit when we talk about individuals that are on restricted housing unit, somebody that might be a psychiatric concern or a suicide watch? How could this system assist us in better protecting those individuals?
Excellent question. So there are a number of different modules is how I would refer to them. That's not necessarily the language from the vendor. That allows for documentation of things like recreation opportunities. So for somebody who's on restricted housing, they still have their rights observed to them. They are just restricted in the amount that they are offered those, as opposed to those that are in general population. There's also the capacity for pictures or video to be documented. So when you talk about somebody who might be at a critical risk, oftentimes we find ourselves reporting, well, they were doing this or they were saying this, and clinical information can really benefit from show me what they were doing. So we could take a video of somebody and we're not going to be passive. If they are not engaging in active self-harm, we would have the opportunity to record that for the psychiatric team to be able to review. We would be able to document, again, all of the different offerings that are happening with each of those persons. So when somebody's on restricted housing, you need to make sure that you're demonstrating contact with the person. We can't leave them in a cell alone for hours without any meaningful contact. So this would allow us to document every single time you have the opportunity to talk to somebody. What were they doing at that time? Did they need additional toilet paper? What was offered or provided? How did they respond in kind to that offering? So that is one of the great features of this, that we would be able to capture a lot of that just by a touch or a swipe on it looks like a phone. The Spartan system is what it's called.
So to me, in hearing that, that it would provide that additional documentation, would I be correct in thinking that this would be an immense risk management tool as far as, any occurrences that would happen at the prison, anything that this system would really assist in reducing the liability of the jail by showing what has been done and documenting that in real time?
Absolutely. So I think it does several things. It holds us accountable to make sure we are doing what we need to be doing, while also providing the documentation that would make us maybe defensible, so that we can say, no, yes, we are having contact. We are doing these things. Right now, there's just not the capacity. We have forms that are obviously completed when somebody's on an observation status, but it captures very little. And this would allow us to capture significantly more.
Thank you.
Yeah, look, I think looking at both of these, both the body scanners and this item, I think this is really a part and key parts of our efforts to make this as great and responsible and accountable and safe of a facility as we can. With body scanners, although we didn't, we're not taking this out of the inmate welfare fund, it certainly cuts to the core of keeping our inmates and most importantly, our staff as well, safe, that they know that there aren't weapons or drugs that can create, overdoses from getting in. And this, I think from an accountability perspective, again, from a safety perspective, and looking at it with the taxpayer dollar hat on, ensuring that we're doing our very best to reduce the likelihood of lawsuits that would also hit the county budget. I think you got multiple reasons for doing this.
Mr. Chair, just point of information,
Yeah.
software systems are an exception to competitive bidding under the county code.
Thank you, Mr. Lazarus. Good to know. Did you get the,
I did. So the annual licensing fee following the implementation is $73,000, which also accounts for that replacement hardware and the management of these documents or services in the cloud. This was also not asked, and I think it's important that the life of the documentation is forever. So where you see that oftentimes with paper records or logs, we just lose the capacity to be able to store this, and we're required by law to maintain records for a certain amount of time. But as we're continuing to move forward with this agency and progression, we'll be able to look back on the life of some of these initiatives for many years to come.
Warden, can you give a sense of how common it is within the Commonwealth for this system to be out of their jails? Do you know it all? Put you on the spot.
I know that the vendor did provide, I did not seek their permission to say which facilities have them, but there are less than 10 within the Commonwealth that have a system like this. I do not believe any of our size do. These are implemented in significantly smaller facilities that sometimes lack additional resources. But this is something that I think a very large agency local to us will be joining the Guardian team too.
And just to clarify on that $73,000 figure, is that per year or is that
Per year.
for years 2 and 3?
Yes. So
So-
the overall total, I just scribbled it down, is 196,100. We would be doing the 150, 100 and the 2023 year. I can't do math.
I'm
It's
not sure.
296.
Okay.
Don't ever, thank goodness you didn't hire me to do math.
Any other questions or comments? I don't think we put this to a motion yet. Is there a motion to recommend the acquisition and licensing of the Guardian RFID system?
I would make that motion.
I hear a motion. Is there a second?
Second.
Any further questions or comments before we call a vote? Hearing none, all in favor?
Aye.
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 Any opposed? It's been approved. Thank you,
Thank
Warden.
you. The final request, and then we will hear from the deputy warden for the deputy warden's report, is a proposal for us to review and increase the wages for our incarcerated persons. This may not be known, but we have incarcerated persons within the George W. Hill Correctional Facility that have the opportunity to be reviewed for employment while they're incarcerated in our facility. There is an eligibility criteria, so everybody is not eligible. But if they are interested in working, they can submit that request to case management for initial review and processing. It's been over 5 years since the entirety of the incarcerated person's payroll has been comprehensively reviewed. So as positions were added, those positions were reviewed for the wage to determine whether or not it was appropriate. The current weekly payroll is budgeted for $3,480 per week, or $180,960 annually. And this is coming out of the operating costs of the institution. So it's important to acknowledge that this is not subsidized through the inmate welfare fund. Worker positions include titles, though this is not intended to be an exhaustive list. And for many of these job titles, there are multiple persons fulfilling these roles. But we have cooks, bakers, sanitation workers, intake runners, tablet runners, barbers, and those that work in our laundry services as well. As we're looking at budget season and our proposals as a facility, we are also looking at the incarcerated person payroll. And because it has been so long since there has been a comprehensive review for the wages, we have recommended a pretty substantial increase, which is a 20% increase overall to payroll, which will increase the weekly budget to $4,176 a week or $217,152 annually, increasing this budget line item for $36,192 annually in our operating costs. And we would appreciate your consideration and determination of this.
Any questions or comments from board members?
I guess I'm just wondering what the average hourly rate is? Is it based on an hourly rate for the work that's done?
Yes,
So,
there is I want to say a tier system
Okay.
essentially for the wages and different considerations of work exposure. If they have to have any additional, we want people who have experience in barbering to do barber services, for example, or those that have maybe some culinary background within our kitchen.
okay. And I'm just not familiar with this program. So is it not tied to any, like minimum wage that's outside of a prison area? So,
No,
okay. Are we talking very low wages for people doing these jobs?
they are not minimum wage as we would be used to in the community.
Right, okay.
Yes.
Other questions or comments? Hearing none, is there a motion to approve?
I'd make the motion to approve.
Second.
Any further thoughts on the matter? Hearing none, all in favor?
Aye.
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 Any opposed? The ayes have it.
Thank you very much, Board. I appreciate your time and consideration. And with that, I will introduce Deputy Warden Fally for his report.
Thank you, Warden.
Thank you, Warden. Good evening, General Sub Board members. How y'all doing? I'm not, last Friday, we sent you guys the data for what we did as far as programs. So I'm not going to go through it in detail. So we just want to highlight the main notable items. Since we took over April, we have successfully graduated 27 incarcerated person who received a GED. That is a very, very huge accomplishment. Thank you, Ms. Krusky and her team for really pushing the incarcerated person to pursue their education. We have enrolled 117 IP to participate for prep. So thank you so much for Administrator Ms. O'Connor and her team. 10 flaggers and 16 IPs receive their certification for Spartan Chemical, which is pretty much a certification for them to have skill set in maintenance and cleaning supplies. We're going to start our training for our current faith-based organization. November 12th is the training for orientation for all of our community-based faith organization. They're going to come back and resume in-person religious services. We did do in-service religious services, but they're IP run and also run with our Reverend Dunn, who does the Catholic services. So we're very excited about that. Warden did talk about voting. I just want to say thank you so much to the Board of Election. Director Allen and his team were very, very resourceful. They provide all the resources. They help us, and also the Women Leagues, and all of our employees at George W. Head was a very collective effort. Thank you, Ms. Shaw, Ms. Krusky, Ms. O'Connor, for all your hard work. MET, we enhance our MET program by providing wellness services. We provided 13 wellness classes for 44 participants who, after they did the MET, they have the ability to have wellness exercise for their advantage. For the month of October, as the warden stated, we have 69 incarcerated persons that has verified buprenorphine. Also, for the month of October, we started working with our juvenile. Thank you so much, EDSI, for coming and provided resources and program available for our youthful offender. And thank you so much for Paul Dickinson, who started the clinical one-on-one therapy for our youth. And then in the near future, we're going to start group therapy, anger management, and trauma-informed care. I'm going to pass the baton to Ms. Shaw, who's going to talk more about reentry services.
Any questions for Deputy Warden Fairley before passes the baton? All right.
Thank you, Deputy Warden Fowley. Good evening, members of the board. For the month of October, I'd like to share a few notable mentions in the programs and reentry department. Through the support of the public defenders, the district attorney, and the probation and parole officers, George W. Hill will be administering our first court-stipulated reentry program. In partnership with the University of Pennsylvania, the facility will be executing the Gold Ring Reentry Initiative, recognized as GRI. GRI was established in 2011 and is successfully administered throughout Philadelphia Department of Prisons. GRI is a continuum of care designed to bridge the service gap between jail and the community, supporting transition back into the community. GRI clients will work one-on-one with the Master of Social Work intern case manager on a weekly basis for approximately 3 months pre-release and 3 months post-release, developing and accomplishing reentry plans designed to meet their individual needs and goals. GRI program directors toured the facility on Tuesday, October 25th. 5 Master of Social Work intern case managers have been assigned to the facility, and we anticipate an end of November start date. Additionally, Monday was the official start date of the First Step program. The First Step program is funded through the Pathway Home Grant and provides incarcerated persons supportive services pre- and post-release to successfully reenter the labor force. Grant funding will support the program over the next 2 years. 9 participants are enrolled in our first cohort, which will meet 5 days a week for the next 4 weeks. Workshops teach foundational skills, job readiness, employability, digital literacy, and job search strategies. Afterward, participants will meet one-on-one with the behavior specialist, career coach, and business representative, with an end goal of attaining employment within a week of release. We look forward to representing the participation and successes of the First Step program in the program's report over the next 2 years. Thank you.
Thank you.
Any questions for Ms. Shaw? Great updates. Thank you. All right, we are at the point for subcommittee reports. Is there any updates from our subcommittee directors? All right, we're at public comment. So any public comments for today? Hearing none. Oh, maybe there is one.
I don't want to disappoint you. I'm Mary Austin, 1036 First Avenue, Media PA 19063. First, really happy to hear, the progress that we're making at George W. Hill and the innovative resources. Really happy to hear that. And appreciated the time to tour the facility last month and talk to some of the women there. Was really enlightening. I just wanted to ask again about the report from Dr. Metzner that I think we were going to get a summary of, but I haven't seen it. I don't know if it's going to be put on the website. And then the Delco CPR is also we have a campaign to collect cards for holiday cards that are going to be going to the facility. That was it. Thank you.
All right, anything further? Hearing none, any board member comments?
I had one comment, and when you had the slide, Warden, about the number of veterans that are incarcerated, it just sort of jumped out that, you know, we have a veterans office, I think that's being reinvigorated under Sandy Garrison's watch and our executive director, and I'm just wondering if there might be in the future, maybe there's an opportunity to, and maybe it already exists, but maybe there's an opportunity to focus in on this group of people that have some commonality to help them reenter. But maybe there's a way we can connect those departments.
I think it's a great point. I think we're, as you alluded to, we will be having a new director of Veterans Services in the county very soon. And I think as soon as that person gets their feet under them, I think it'd be a great idea to connect them to the jail to see what we can do to bring those programs and services to our veterans there.
That's all I had.
Thank you, Controller. Anything further for today? Hearing none, I would entertain a motion to adjourn.
Motion.
Second.
All in favor?
Aye.
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 Any opposed? We are adjourned.
Thank you.
Thank you all.
Thank you.